This is KARK 4 News at 12:30.
We're approaching the time of year when people are more social with holiday parties and get-togethers. And one thing that can really put a damper on seasonal social encounters, bad breath. Dr. Brian Dunlap of Dunlap Dental is here to talk about halitosis, bad breath. First, let's start with what is the typical bad breath that we experience?
Well, I mean, most of the time, yes. I mean, so let's just talk about basic bad breath. Your first move would probably be to improve your habits, improve your dental habits. Just brush and floss better. I know that sounds pretty obvious, but do that first of all, because if you're not doing real good with your oral hygiene, then that's an obvious possible cause of bad breath.
And these are some products that we can readily find in stores that can help that, of course. The mouthwash, floss, right? A good toothbrush, you're changing it at, every 3 months as you're supposed to. That's our first kind of fight, our first defense against it. And for most folks, that would probably do it. But if that doesn't improve, we need to visit back with you because there are some other reasons why we may have bad breath.
That's right. There are potential systemic issues that can be going on that go beyond just simple things like, oh, I've got coffee breath or oh, when I'm eating and drinking. Now, first of all, let's just talk about the dental basis. If you have some really bad breath, a lot of times it could be signs of a dental infection. I mean, you could have an abscessed tooth or some serious gum disease. That can cause some serious bad breath. So that's something that you definitely want to get checked up with your dentist because that means you've got some problems going on that are not going to be fixed by a mint.
Now, if we go beyond that, what could be some other causes that maybe we need to see more than just you?
Right. I've had some patients in my office that complained about having some chronic bad breath, and we checked and they didn't have any dental problems, so we suggested checking some potential metabolic problems, and we've actually found that oftentimes it can be a sign of diabetes, believe it or not. So we've had some patients that had some chronic bad breath that didn't seem to fit the mold as far as didn't have any dental problems or anything else, and it turns out that there can be some disorders such as that can be diagnosed by bad breath, believe it or not.
Such a simple problem, but you got to take care of it and pay attention to it as well. If you've got concerns, you might want to see Dr. Dunlap at Dunlap Dental. Of course, we've got his information on our website, arkansasmatters.com, and get it checked out because you never know, it could be more than just your ordinary bad breath. Dr. Dunlap, thanks for coming in this afternoon. Stay with us.